Hey, welcome to Healthy Time with Peer Docs. Just a reminder, this is for informational purposes. This is not medical advice. Please follow up with your primary care provider should you have any questions or concerns. Enjoy the episode. All right, so we'd first like to start by voicing our appreciation for all of your love and feedback from our first episode. As many of you know, this is something that we've talked about, we've thought about it, and we decided to just take the jump. So here we are. Today, we'd like to officially introduce ourselves. I am Dr. Ardarian Pierre.
I am Dr. David Pierre.
And together we are Pierre Docs. We are passionate about all things health, wellness, family, and of course, community. We'll certainly get into more details about us, but today we're going to chat a little bit about prostate cancer. September is Prostate Awareness Month, and we'd like to share a few high points, whether it's of benefit to you, your father, your brother, your best friend. We'd like to talk about it for a few minutes today.
The prostate is a gland in our male reproductive system located just below the bladder and in front of the rectum. It's about the size of a walnut, and it supports part of the urethra, which is the tube that empties urine from the bladder. The prostate gland produces fluid that makes up part of the semen.
Okay. So how does prostate cancer actually occur? How does it happen?
So basically, cells go haywire. As a man ages, the prostate increases in size and causes the urethra to narrow and decrease urine flow. This is called benign prostate hyperplasia, or BPH. Some refer to it as benign prostate hypertrophy. And so this is not the same as prostate cancer, and we'll have a separate episode on that.
Okay, so I need you to expound a little bit more. Give me all the facts about prostate cancer.
Okay, well, I have my cheat sheet, which I'm going to use because I'm out of medical school and I'm not memorizing all this information. So prostate cancer is more common in older men with a family history of prostate cancer, mostly of African-American descent. Personally, I've seen this in my family with some of my uncles that have been stricken with this, and thus myself having to go in for early screening. Some risk factors for prostate cancer: certain hormones, some vitamins, high intake of dairy and calcium. In the United States, about 12.8% of men will be diagnosed with prostate cancer at some point during their lifetime. African American men have some of the highest rates for prostate cancer of any racial or ethnic group in the United States. Statistics show that in 2018 to 22, Black men were twice as likely to die from prostate cancer as white males. So some of this stems from genetic and socioeconomic factors, such as not having good access to healthcare, not getting screened appropriately or in time prior to it reaching a stage that is not treatable.
So, Dr. Pierre, what are some symptoms? What will I look for?
Believe it or not, some people don't exhibit symptoms, and everyone exhibits symptoms at a different level when they do present. Some of these symptoms may include difficulty starting urination, weak or interrupted flow, frequent urination, incomplete emptying of the bladder, a lot of nighttime awakening to urinate, some burning. You may even see some blood in your urine or your semen. You may have some pain in your back, your hip, your pelvis, painful ejaculation. And also keep in mind that if these symptoms do occur, that does not just point to prostate cancer. There may also be something else going on that you may need to see a PCP for.
Exactly. It could be a urinary tract infection, another systemic infection. So oftentimes symptoms will indeed overlap. So let's talk about screening. My first question is, what is screening? What does that mean?
So screening means getting yourself checked out for something. In this case, we have different tools that we use to screen for prostate cancer. There are different schools of thought by different organizations on what these tools should be, but we have certain tools such as your PSA, your prostate specific antigen, or a digital rectal examination, which is known as a DRE. And those are some of the tools that we look for screening. In addition to that, there are also further down the line some imaging studies that can be done to establish diagnosis as well as a tissue diagnosis, which some refer to as a biopsy.
Okay. So how do I know when these screenings are needed? I know I need to see my primary care provider, but what are some things that they'll think about, or how will we decide if we need to get screened or not?
Most likely based on some of the symptoms that I previously mentioned. If you have any of these symptoms, you most likely need to see a PCP first and establish a screening tool, such as using a PSA or a DRE.
Okay. So how does one know when to consider being screened? By that, I mean, should a 20-year-old consider it, or 40-year-old? Like, how do I know what age I should start really thinking about prostate cancer?
Yeah, it's recommended that men who are 55 to 69 years old should consider being screened, discussing the risk or benefits of undergoing these screening tools that we mentioned. Men who are 70 or older should not be screened. And if you have a family history, a direct family history with some of your uncles or some of your cousins may have been diagnosed with prostate cancer, that moves up your age of screening to, let's say, 40 years old or even earlier.
Okay. Thank you, Dr. Pierre, for all of this information. My question is it preventable?
Like most other disease processes and diagnoses, most oftentimes it'll be recommended for people who are diagnosed with these conditions to follow some what we think are basic things, which may not always be the case. But of course, maintaining a healthy weight, exercising regularly, having a healthy diet, limiting your alcohol intake, quitting smoking. These are things that may aid in preventing acquiring prostate cancer or being diagnosed with prostate cancer.
Thank you. After one is diagnosed, how can they go about living a fulfilled life?
Okay. Okay. I meant to mention before, part of the prevention, of course, is screening, which is something we touched on earlier. Living with prostate cancer may be difficult for some people, but with other cancers that people face and are diagnosed with, it's always good to seek help. Don't do it in a silo. Don't do it independently. Seek help from your family, your friends, physicians that are around you, nurses. If you're struggling with dealing with it, there may be support groups that you may be able to join and be a part of that may help to encourage you to go forward. Lifestyle changes, like we talked about, healthy eating, diet, exercise, that can help. Learn about the treatment that you're undergoing. Learn about the side effects that you may have from treatment, so you may be able to deal and cope with it better. Follow up with your doctor, regular follow-ups, as schedule, compliance, adherence to medication or treatment regimens are important.
So I'd like to interject here just to say I'm reading a book, or recently read a book called Find Your People. And the same goes with, whether it's a cancer diagnosis or just life in general. Be sure to find your people and keep a good support group around you at all times. So, Dr. Pierre, are there different types of prostate cancer? And if so, what are the stages?
There are different types of prostate cancer, which colloquially most people aren't aware of the different types that there are, because we generally use the umbrella term prostate cancer. But there's adenocarcinoma, there's transitional cell carcinoma, squamous cell carcinoma, small cell. You may have heard these terms in lung cancer because that's frequently used with lung cancer, but they are also dealing with prostate cancer. And as far as staging goes, they're staged like other cancers also, starting from stage 1 to stage 4. And of course, stage 1, it has not spread to any other part of the body. And you can go all the way to stage 4, where there's the spreading of cancer to your lymph nodes and sometimes bones and other vital organs.
And oftentimes, even at stage 4, so it's stage 4, which is considered, most advanced, there are treatments, and there oftentimes, if it's caught early enough, you can be completely treated for this. So anything else to add?
No, I think that wraps it up pretty well.
All right. Thank you so much, Dr. Pierre.
Thank
Have
you.
a great one.